welcome to another episode of the Embracing Joy podcast. It's great to have you all who are listening.
Right.
Welcome. I have a very special guest with us today, Dr. Loretta. Pronounce your last name. It's Duggan, right?
Right. Yep. You got
Duggan.
it.
Okay. Yeah, Dr. Loretta Duggan. It's a pleasure to have her on. And our topic today is embracing joy in adolescent health. We were all adolescents at one point.
That's right.
And, it could be a very difficult time,
hmm
with the change in hormones, growing, all sorts of things happen during that time, which are
Yes.
fundamental to who we are as adults.
hmm
Or some of us also have adolescent kids, as young professionals, you may have kids that are in adolescence or family members that are in adolescence. So I think this is a very important topic that we are discussing today. And I'm going to give you a brief intro. First, I'll let Dr. Duggan say some things about herself, and then I'll give her intro, and then we'll get started with the episode. All right.
Awesome. Well, thank you so much, Doc. Thank you for having me today on your podcast. Really excited about our talk today. And hello, everyone. My name is Dr. Loretta Duggan. I am trained in both family and adolescent medicine. And I'm also the CEO and founder of Her Health. So, Her Health is located in Athens, Georgia. And what we do is help 11 to 26-year-old young ladies to confidently embrace their menstrual, their reproductive, and their sexual health to live the life they choose. Really excited to discuss more about that and kind of my journey on how I got there as well.
Oh, that's great. I think that is so important, and it's also kind of unique because most of us have seen maybe a pediatrician or a family physician,
hmm
but a lot of us, especially during adolescence, we haven't had a doctor who is just focused on that key age group, which is, that 11 to 26 age group, adolescents. So we'll go into more about that later because I'm very curious as to what made you decide to really focus on that population. Yeah, so I just wanted to give a little bit more about Dr. Duggan. So she has her own medical practice, Her Health, and she told you already, she focuses on the needs of teens and young adults in Athens, Georgia. She's a graduate of Morehouse School of Medicine, and she's also a graduate of Spartanburg Regional Family Medicine Residency, and she also did her fellowship in adolescent medicine at Nicholas Children's. And she's board certified in both family medicine and adolescent medicine. So she is definitely an expert in the area and has a wealth of knowledge and experience. So it's great that you're bringing that back to the community in your own way and your own practice.
Yes.
So, yes, we start usually with a quick game. So it's a quick warm up game. Uh,
Okay.
and it's called Convergence.
hmm
So what you'll do is say the first word that comes on your mind, and I'll say the first word that comes on my mind. We try to say it at the same time, like on the count of three.
Okay.
1, 2, 3. First word that comes to mind,
Got it.
and
I'll think fast.
out of our, it's a game to kind of get out of our heads or stop overthinking too much, and just to say the first thing that comes on your mind, and then we try to connect the two to see if we can get on the same page, or if I can read your mind, or if you can read my mind.
All right. Let's see what we got. Let's see what we
Right.
can do.
Right. So example would be like if we say apple and you say like, sandwich, and with something that connects the two. And then the next word is like, oh, lunch. And we both say lunch at the same time, or something that
Gotcha.
broad but may connect the two. Ready?
All right. Let's
All
let's see what we
right.
come
All
up with.
right. All right. So the first word that comes to mind on the count of three. Okay. 1, 2, 3.
Cake.
White.
So
I said white and you said cake.
yeah.
Okay, so
Right.
white and cake, something that connects white and
White and
cake
cake.
together. Ready?
Okay.
All right. 3, 2, 1. Wedding.
Coconut cake.
Coconut cake. Okay, coconut cake and wedding.
I'm still on
Something.
cake.
Yeah, yeah, yeah. It's okay. That's okay. You can go anywhere with it. So coconut cake and wedding. Okay. So we
Okay.
try to keep it a little broad. So coconut cake and
Okay.
wedding. Okay. So Three, two, one.
The beach.
Vacation. Oh, yeah.
Yeah.
So beach and vacation. I was thinking like, oh, okay, destination one.
Yeah, exactly. Exactly.
Yeah.
Like a beach
I was
wedding or
thinking like
something. Yep.
destination wedding. Yeah. All right. So beach and vacation. Ready? Something that connects those two together.
Okay.
All right. Three, two, one. Resort.
Florida.
Oh, okay, Florida. That's right. Florida, that's where I am. And you
Right. I
did
was like the beach,
your fellowship
Miami.
in Florida, right? Here in
Right. I
Miami.
was thinking
Yeah.
Miami the whole time.
Yeah, Miami. Okay, so Florida and a resort. We're kind of really narrow, but something that connects those two. Florida and resort. All right. Three, two, one. And we can't use the word that we said before. Sorry, we'll repeat it.
Okay.
Okay. Three, two, one.
Disney.
Orlando. I was thinking
Yeah.
Disney too. I was like Disney, Orlando. Okay, that's
Disney
it. We
resort.
matched that because I the first word I was thinking was Disney, and then I said Orlando, but yeah,
Hmm.
that was it. We
Yeah.
matched.
They
Because I was like
Disney wins all
Disney,
day.
Disney.
They win all day.
All right, all right. So let's get into these questions. So, tell us what inspired you to create your practice and to really focus on that population, and how are the needs of your population different from just a traditional gynecologist office? What would you say?
Right. So it definitely didn't start off this way. I
Hmm.
really had to focus on prevention coming
Hmm.
from rural Georgia. So super small, limited in terms of specialists and doctors that were available. And then losing my grandma too to a heart attack. So that kind of set the course for me to pursue medicine in the first place. So I was going to
Hmm.
save everybody. We're going to save hearts, no strokes, all the things, right?
Hmm.
But what I realized while I was training in family medicine was that I had my own story too. Deep, deep, kind of buried down in there was my story, which I'd really come to normalize it. And that was my struggle with my own periods. They were kind of heavy and really, really painful, like to the point where if I wasn't on top of it, I was out for the count, at least for like a
Hmm.
day or two.
Hmm.
And that was through middle school when they first started, high school. So from missing class, even into residency, sometimes missing rounds because of it.
Hmm.
And it wasn't until I was on my women's health rotation, and we learned about the different things that hormones can be used for, the different things that birth control can be used for. And I was like, what? What is this
Hmm.
that you're talking about? What is this magic that you speak of? Right. And from there, really sparking more of my interest in women's health. For one, because now I had my own diagnoses and I had a treatment for what
Hmm.
I've been dealing with for like almost 3 decades now.
Hmm.
And then two, I really enjoy interacting with my teenagers. I never felt that I have enough time with them, but that was the age that I felt you could affect so much change earlier
Hmm.
because you're catching them right as they're starting to transition into their adulthood. They're making
Hmm.
their own decisions now that they're in high school or they have their own job and they're hanging with friends. So you're catching them at a critical transition point now where you can affect preventative care so much more. And so that's what really drove me towards them. And I found out there was a fellowship, adolescent
Hmm.
medicine. Who knew that
Hmm.
I could just focus on teens all day, every day, whatever they needed? And so that's kind of how I took that detour from family medicine to adolescent medicine. But
Hmm.
even with that, once I graduated and finished, I went back to rural Georgia,
Hmm.
still, wanted to come back to serve all the things. But after about 5 to 6 years in, I was like, this is not going to be for me
Hmm.
anymore. So I really wanted to focus more on my adolescence from that gynecology standpoint because one, we didn't have enough time in the model where I practice with the
Hmm.
FQHC, and that's the
Okay.
federally qualified healthcare center. So we
Hmm.
take everyone, insured, uninsured, underinsured. We don't turn
Hmm.
anyone away. And that can lead to a lot of complex problems in cases that we're dealing with patients
Mhm.
because they may not have had care for a long
Mhm.
time, which I still enjoyed. I love seeing the
Mhm.
generations for
But it was
sure.
all ages that you were taking care of, like from childhood on, like the
So I
traditional family
started
medicine
about
model?
8 or 9, all the way
Okay.
up. Like I had some
Okay.
patients that were like over 100. I loved
Mhm.
it, and I was
Mhm.
like, "Why are you here? Go home. No, call me. You can have what you want." But I still kind of had that itch for something more.
Mhm.
And what lit me up was it was my teenagers. It was talking about, birth control or what they're thinking about, or making sure they're screened for sexually transmitted infections, and asking them about their peers. Who is it that's influencing them, and why is
Mhm.
it you chose them over maybe somebody else?
Mhm.
And that became the focus, and I really felt the only way I would be able to do that would be in private practice,
Mhm.
without going to an academic center, without going to a much larger city, and really kind of focusing just on gynecology.
Mhm.
That really, like I said, became the focus. And private practice was the way that I saw to do it best. And here we are with Her Health. We've been open since June. Yes, June of 2024.
Yeah, that's great. Yeah, you have an infant that's growing, and I'm
Yes,
sure
it is
that's
truly a baby.
a
Yes.
baby. Yeah,
Yes.
baby practice. So, and it's growing, and
Mm-hmm.
I'm sure, and it's such a needed area. So your
Right.
practice is in rural Georgia, right? So you wanted to stay in your community, and that's why you decided, that's a part of the reasons why you decided to open your own practice too, rather than
So
moving to.
actually, I moved. Well, I've
Okay.
always lived in Athens, but I practice
Okay.
outside of Athens. So now I
Okay.
actually practice in Athens, which has a larger college setting as
Okay.
well. And so definitely not rural
Not
anymore,
rural.
but
Okay.
it's still
Okay.
close enough that hopefully people will start to come and find me even from those rural areas as well.
Right, right. Because, that's good that you have a good source of people in the area that you can see as well. Yeah.
Mm-hmm.
Okay. So tell us about, because you're definitely a high achieving professional entrepreneur. Have you, especially starting this new practice over the last 6 months, and it's something you're very passionate about, but have you found any like certain strategies helpful in maintaining your joy and balance while you're building and running this practice and trying to not get discouraged with the challenges that may come, but also finding that joy and sustainability in creating this new practice?
Right, right. It's certainly a balance. I
Mhm,
don't know if there's such thing as really balance, but you
mhm,
kind of figure out what works for you and prioritize what's important to
mhm,
you.
mhm,
So if it's not on my schedule, it just doesn't happen
mhm,
because my little Google Calendar or my phone or my written calendar is in multiple places, but that's kind of what the world centers around right
mhm,
now. And so really, if it is a priority or if it's something coming up with family, something coming up with friends, I have to make sure that it's on the calendar to make sure that it gets done, just like a meeting or a marketing event or being present, in the office, things like that. It all has to be scheduled now.
mhm,
And that
mhm.
was one of the big things that I had to learn because I was like, oh, yeah, I get it done. Or I remember. And then
Mhm.
things started falling off. I'm like, oops, sorry. Yes, let's
Yeah.
reschedule. And so to help avoid all of that, just really
Mhm.
having a calendar, having it in multiple places, that has been like really a lifesaver for me.
Mhm.
And then, two, I would say that being flexible in the process of learning the entrepreneurial side, the business side of medicine, it is
Mhm.
not halfway as straightforward as working, as an employee for someone else, the
Right.
hospital, etc. It's a totally new ball game that
Mhm.
we do not
Didn't
learn
have the
about. We are
training
not
for.
taught
Yeah.
about. No, we are not taught at all about
Mhm.
any of this, taxes, none of
Mhm.
the things. Everything just come out of the check and then we just get what's left. That's what we're used to. But now, okay, we're cutting a check. We're knowing exactly where the revenue comes from. We know exactly what's going out and supporting the practice, supporting it as it's, new and growing. And
Mhm.
so that definitely has been a newer aspect.
Mhm.
Nothing that's impossible because,
Mhm.
as our coach says, I don't know, we've done very hard things before.
Mhm.
So it's just a matter of learning, putting the check boxes, knowing what next steps that we need, and then continuing to move forward from there. The other thing that I'll say, kind of going back to our first question, is what kind of makes the practice unique
Mhm.
is really focusing on that one to one time with our teens and our young adults. A lot of times they may have someone that comes in with them, which is fine. But at the end of the day, we know that some are not going to talk if,
Mhm.
mom or auntie, whoever it is that came with them, are in the room too. They just may not disclose everything that's going on, even though they may be like, we have such a great relationship. We tell each other everything. I'll be like, uh-huh. We'll
Mhm.
still have them to step out, and then we'll still, talk about what we need to.
Mhm.
And establishing the kind of not ground rules, but making sure they understand what is confidential and what's not.
Mhm.
Because once you actually gain their trust,
Mhm.
that is a very critical thing. It's something that is super important. So if they tell you something that is no longer confidential and you need to say or bring in other outside parties, they're going to be like, well,
Mhm.
hold on, what happened?
Mhm.
So explaining that up front, making sure that we take the time to go through it and giving them that one-to-one time. And the beautiful thing is now parents, guardians, they know what we do. They know why we're here. We are
Mhm.
here to talk about reproductive care, sexual health, all the things. And
Mhm.
literally, I tell you that they are like, all right, you ready for me to step out? Or y'all good now? Like
That's
they are
right.
leaving the room before I even get to that part now because they understand the assignment. And I love it. I
Mhm.
absolutely love it because it gives us more time for us to establish that relationship, to go through the things that are important for that patient then
Mhm.
and there. And that helps me so I can now counsel better. We can come up with a plan. We can discuss the next steps in their care based off what's most important for them as well. So, it's been great being, like I said, being in practice because now
Mhm.
instead of like, hey, it's that time, we're going to expect you to step out of the room and they may give a little pushback. Now they're
Mhm.
like halfway out the door, like, see you, we'll see y'all when y'all done. So we
Yeah,
can
I'm sure
talk
it's a
about
relief
all these
for a lot of
important
a
things.
lot of the parents. They're like, "Whew, I don't have to talk to this kid about this. You
Yes,
go ahead with
yes.
the
They have somewhere
expert
else.
and the
Mm-hmm.
expert."
To
Yeah.
have those uncomfortable conversations. And I'm like, bring it. I love it. So it's been really exciting. It's been really fun to see. And it was an unexpected thing as well. But I think just because of the type of practice it is, it's almost understood now.
Mhm.
And it's been great. The parents have been great. The kids have been great too, the teens and the young adults. So it's exciting.
I love that. And that trust and building trust and that open
Mm-hmm.
communication with the teens is
So
so
important.
important. And you sound like you foster that and value that and do it in a way where a lot of the teens will feel more comfortable with you. Just your personality in general kind of breeds a little comfort too. So they they may
Thank
feel a lot more
you. I
comfortable
try.
like sharing that with you. And
Yes.
I think they need someone where they can feel like that they're not being judged for what they may have experienced or what they may
Mm-hmm.
be going through or what questions they may have, right? Because they may
Yes.
have questions, they don't know a lot of the things, but they may have heard
Mm-hmm.
things and they just want to, get those questions answered. And it's good to have it
Exactly.
from an expert with medical knowledge, not from their TV, not from their friends, and
Mm-hmm. Yep.
not feel comfortable asking their parents.
Yep.
So
And no
this,
judgment.
and
No
no that's the
judgment.
key,
I'm
no
here to
judgment.
listen. What is it now? It's listen and not judge.
Oh
That's what
yeah,
I see
listen and
now
not
on
judge.
TikTok.
We listen and we
Yes, we
don't
listen
judge,
and we don't judge. That's right.
right? We listen. And
See, you right there. You right there
yeah,
with us.
yeah.
That's
So,
right.
yeah. So we'll go ahead to our wrap up questions. It's such a pleasure learning about your journey and your
Thank
practice
you.
and how you're able to help teens, especially with their gynecological health, their reproductive health, and periods. Goodness, especially from a young age to have that support during that
Mm-hmm.
time. I'm
Right.
sure we all have our stories of our first period, if we had information or didn't have information.
Exactly.
I did not have information. I thought it was
Me either. I
dying.
was gonna say I was like a blank slate. I didn't know what was going on. I had an older sister, but she didn't talk about it. And then I was like,
Same,
ain't nobody else talking. And my
same,
doctors weren't asking. My doctors weren't
same.
asking either. So I wasn't volunteering anything. So I just
I,
dealt with.
I ran through the house and I thought I was dying. I was like, hey, and I have three sisters. I have three sisters older than
Mm-hmm.
me. And your sister
And
older than
nobody,
me.
nobody,
Nobody.
nobody wanted to share.
The
Nobody wanted
first
to
one,
share.
I was like, what is going on? They were like,
Oh.
but then I got the conversation afterwards, right? So,
Mm-hmm.
but of course, having that conversation ahead of time or right
Before.
when you're about to, so that you're
Mm-hmm.
prepared
Give
and
me
then
some
you
kind of
know what
heads up so I know what I'm dealing with
you're
these
doing.
next few decades, right? Give me a little bit of a head, just a little bit, and I can take the rest, but give me something.
Right. Right. So it's just so important. So I'm glad that you're out there and spreading the knowledge, that teens need and young adults need.
And I was going to say,
So
speaking of, sorry, before you go to that, I'm going to have a period party too
mhm.
that's coming up for just this reason because we want to talk about all things periods, knowing what to expect, what's normal, what's not, and all the different period products now because there are different ones that are out or more mainstream, I should say. So knowing how to use them,
Mhm.
demonstrating them, letting them kind of touch and feel and understand how all these things work. So I'm really
Mhm.
excited to do things like that, right? So we can
Mhm.
bring those experiences earlier versus a
Mhm.
lot of trial and error, like you said, just getting misinformation about them.
Mhm. Or no information. Well, see,
Or
too young, you
none,
don't,
miss or
or no
none.
information.
That's right. That's
They're like,
right.
oh, she's too young to hear about this. She doesn't need to know, or whatever. But,
Mm-hmm.
it should be from a young age. And I'm sure parents get busy. They just, or they don't want to bring the topic too soon, or they have different,
Yeah.
yeah, different thoughts about it. But having the
Mm-hmm.
information is very valuable, especially for girls, because other people in your class may be going through it and you don't know how to support that. So,
Exactly. Exactly. So yeah,
all,
I'm excited to do it. So hopefully I'll bring all the kind of questions and things that they want to know that
Mhm.
others are uncomfortable about so that we can put the information out there and they know where to go. They know where to
Mhm.
go if they have more questions or concerns about all the things.
Mhm. That's great. So our wrap up, let's go to our wrap up questions.
Okay.
Okay. So Dr. Loretta, who is a model for joy in your life and why did you pick that person? It could be someone living, not living, it could be a family member, not
Mm-hmm.
family member, it could be anyone.
Yeah, that's such a great question. And the person that came to mind first for me was Maya Angelou.
Mhm.
And, it was just once she found her voice, the amount of wealth and beauty that came through her works and her artistry, it was
Mhm.
just amazing the effect that she's had and her legacy that continues to live on. And
Mhm.
so she was one of the first persons that came to mind when I thought about that question. And
Mhm.
her poem Still I Rise, like it always just it's a go-to for me when I
Mhm.
need a little bit of that pick me up to
Mhm.
get me back on track, to get me back in the game and
Mhm.
things. So absolutely love, love, love Maya Angelou.
Mhm. Cool. I don't know if you have it. Do you have it memorized? There's that line where she says,
I was like, it's been a while.
well, I know it's been a while too. I was like, but the line that I love is where she's like, "Are you mad because I laugh like I have oil fields in my backyard?" Right? Something like
Hmm.
that. Yeah,
Like
it's
I
like
was pumping in
she
my
because
living room or something like
pumping in
that.
my pumping in
Yeah.
my yes.
Mm-hmm. Mm-hmm.
Yeah, because though she may not be the richest, the wealthiest, it's like an inner strength, the inner power, and
That's
she can
right.
laugh freely because
Mm-hmm.
that's her own gift from from the higher power. It's not something that an oppressor or anybody else has to give her. That's
That's
hers.
right.
And she can just laugh freely and live freely, even if people are offended by her presence. So
In
I
spite of.
yeah, in
Yes.
spite of and even if and so I love that poem too. It's a great one.
Mm-hmm.
All of her poems are really good.
They are.
Yeah. Yeah.
Yeah.
So my next question, it's more like a hypothetical question. Like if you were thinking of joy and you were thinking of your ingredients for your joy, right? Certain ingredients that would make you happiest. And you were making this cake of joy for yourself. It doesn't have to be a real cake, but if you want to include cake, you can. But if you were making this cake of joy for yourself, what would be your top three ingredients?
Well, the first one, it would have to be laughter because I
Hmm.
really like we've been doing it pretty much the whole time. But like we really can't take ourselves too seriously, the situations too seriously because life can get heavy. Life can get hard. And so really a way to find that joy is really through laughter. So that would definitely be one of the first things I would add to my cake.
Hmm.
The second thing would be travel. And I
Hmm.
think of travel as a way to open our mind to new exposures, new surroundings, and to new possibilities,
Hmm.
right? So if we're closed in and we only know our space in one space, think that's the only way and the right way, then we're
Hmm.
missing out on an entire world that exists that we could actually learn from
Hmm.
and live through. So that will be the second one. And then the third one, okay, I literally put cake because it's like my favorite.
It's your favorite.
But
That's fine. You can have cake. Cake makes a lot
um
of people happy, so it's
yes,
okay.
red velvet cake is so comforting to
Mhm.
have. At times, just need to get away, step away, let it be a end of day pick me up. So
Mhm.
red velvet cake is just one of my favorites and always a go to. So if I had to make a cake, yes, it would be a red velvet
The
cake
red velvet
and the
cake.
other two, and a little bit of
That's
travel and a little bit
completely
of
fine. We
laughter.
can add it to your recipe of
There
your
you
cake
go.
of joy. That's completely fine.
That's right.
Yeah. So this was a wonderful interview. If you are listening and you are in Georgia, or you have a teen in Georgia, or you're a college student in Georgia and you're looking for someone who specializes in adolescent medicine, which is your ages 11 to 26, who can care about your women's health needs, your gynecological needs, especially in Athens, Georgia, please reach out to Dr. Loretta Duggan. You can find her on Instagram, TikTok, YouTube at Loretta Duggan MD,
Mhm.
or Facebook at Dr. Loretta Duggan Her Health. And then she also has her website, which is www.herhealthga.com.
Yes.
And you can add if there's anything else. And if you are in the area and you're listening to this now, she's also having the period parties this weekend, or when is it?
Yes, it is. It's coming up December 14th
December
at
14th.
11 in the morning. So you still have the rest of your day to do what
Mhm.
else you need to do. So really excited about that. And we're scheduling new patients too. So feel free to stop by Her Health or reach out to us. We'll be glad to talk to you more.
Okay, great. So this was a great episode. Thank you, everyone who has listened. Hope I know that those of you, especially women, we have some men in the audience too, probably, but mostly
Mhm.
women can take some feedback from this or remember their time as adolescents, or if you have an adolescent child and that's interested in an adolescent specialist. If you're not in Georgia, you could still reach out to Dr. Loretta Duggan on her Facebook, Instagram,
For
TikTok, and
sure.
follow her to learn
Yes.
more information about your health. Take care. This is a great episode.
Yes.
Bye. Make sure
Bye,
you like, share.
everybody.
Bye.